If you're a dentist and you struggle communicating with new patients, this video is for you. If you're new to the channel, my name is Siju Jacob. I've been a private practitioner for the past 25 years in Bangalore and Dubai. I've been using a surgical microscope in my private practice for more than 20 years, and I've been training dentists how to incorporate the surgical microscope in everyday clinical practice for more than a decade. If you've been here before and you found some value in the videos that I post every week, then don't forget to click on that subscribe button so that you get notified every time I upload a new video, which is usually every Sunday. You can also subscribe to my weekly newsletter. I've put the link in the description below so that you get even more useful information delivered right into your inbox every week. Welcome back to the channel. This week we are going to talk about something really important: how to talk with the patient. How often have you had this scenario? There's a new patient at your practice, you've never seen each other. The patient comes in for a consultation appointment, comes into the operatory, you greet each other, you say hi, the patient sits on the chair, you sit, you look at the patient, and the first question you ask is, "So, Mr. Jones, how can I help you? What's wrong with your tooth?" And the patient stares back at you. Patient tells you what's wrong with the tooth, you give some solutions, but somewhere deep within you find that you aren't really able to connect to this patient. Now, this is a problem with lack of communication and rapport building, and this is what we're going to talk about this week. I once heard Dr. Gary Carr, the father of modern microscopic endodontics, say that there is a very important distinction between talking with the patient and talking to a patient. Most dentists talk to a patient. They don't talk with the patient. And the main difference is that when you are talking to a patient, you are kind of giving sermons and solutions. When you talk with the patients, you are trying to do something together as a team. You're trying to build communication. You're trying to build rapport. There is a big difference between the two. And what we are going to talk about this week is how to talk with the patient, not to a patient. So first, let's address the problem. Find out why it's important to talk to a patient in the first place. Why put in all this effort to build communication and rapport in the first place. And then we'll talk about some of the solutions or the actions you can take to build communication and rapport. Why is communication and rapport so important? When a patient walks into your practice for the very first time, you have to connect with this patient on two different levels. The first level is where you connect as a human being, and then is the second level where you connect as a doctor. So in the first level, you are trying to establish rapport and communication, whereas the second level where you provide solutions. Now both are very different. And both are time sensitive. When you see someone for the very first time, you aren't trying to give solutions. Your first goal is to connect with them as a human being. And only after establishing connection as a human being, you move on to phase 2, or the second level of connection, where you provide solutions. Connect with them as a doctor. So this is the challenge, because most dentists are very good at part 2, connecting as a doctor. They see the problem, they provide solutions. They're very good at that. But they're very, very poor at the first part, which is to connect as a human being. And this is what we hope to address this week. This is not a difficult skill, but it is something that a lot of dentists struggle with. I know so many dentists who are unbelievably skilled clinicians, but struggle to establish connection with the patient because they fail to connect as human beings. And as a result, they don't get the appreciation that they deserve from the patient because they've neglected this first part. When they meet a patient for the first time, they don't have it in their DNA that they have to connect as a human being first and then connect as a doctor. So this is what we hope to address this week. First, let's talk about why is it so important to connect in the first place. It is important because our first goal is to develop trust with a patient, and it's very difficult to develop trust if two people aren't on the same level or they are on the same plane. Now, by definition, when a patient walks into your clinic, they are not on the same plane as you. They are coming into an environment which is very foreign to them. It looks intimidating. You have all these equipment around, you have the chair, the tools, and then there's you in your scrubs and your coat. You are intimidating. You know some stuff which they don't know. You know a lot of stuff about their teeth and all these terminologies that they are not aware of. So they're walking into an environment where they don't hold an upper edge. You hold the upper edge. So you are at a different plane in terms of hierarchy in that environment, irrespective of what qualifications they have. So your goal as a clinician in your environment, when you see someone who's not from that environment, is to first make this patient relaxed and bring down that level of yours to a level that's theirs. come down to their level, and then establish communication and rapport. This is the goal of breaking through the ice and finding some common ground. Try to erase this difference in hierarchy that exists when someone walks into your practice for the first time into an unfamiliar environment. So this is our goal. I hope that by this point, I've sort of convinced you as to how important this problem is. And then we look at some of the solutions to this problem. How can we build communication and rapport? The first principle we can look at is the similarity principle. As human beings, we tend to like people who are similar to us or whom we aspire to be. So these are usually the two categories where we tend to develop rapport and connection. So when a patient walks into your operatory for the first time, our first goal is how can we find something similar that we can connect on? And we don't know anything about this patient. So our goal in the first few minutes when you see this patient is, what are the similarities and can we find something similar on which we can bond on? So this is your task. And this happens from the very first time you meet the patient. You're looking at how they dress up, how they behave, how they talk, and you kind of get some clues. For example, if they are someone who's very fit, you can see that they're probably fitness conscious and they probably watch what they eat. So that could become a topic if you two have similar interests. Or it could be the other way around. Let's say you're someone as a dentist, you're trying to lose weight and you see someone who's super fit, then you could ask them clues on how to do this. So that becomes a topic of interest. Or you could ask them what kind of music they listen to. That could become a point of interest and something you can discuss. Who knows? Maybe both of you are fans of the same musician. So that becomes a common bonding on which you can talk about. So like this, there are so many things that you can fish around. So our goal is we are trying to throw some hooks and find something where you can talk about. We don't know what it is. So there is no perfect template, but with a little bit of training, you can do this. You can keep poking and find some small thing which you can bond on. So that's known as the similarity principle. The second principle is that you have to be genuinely curious about what you are talking about. You can't just pre-frame some sort of a script that some management guru has taught you and then you just vomit out those scripts. I've seen this happen all the time. Patient walks in and then the doctor says, "Hi, how are you doing? Nice watch, nice hair, you're looking so good." And then they don't have anything else to talk because it's so fake, right? So you don't randomly look at someone's shoes and tell them nice shoes if you don't really feel those shoes are nice and you have some sort of an interest as to where they bought those shoes so that, you could buy those shoes for yourself or your loved ones. There has to be some sort of a genuine curiosity on what you're talking about rather than randomly throwing scripts out there. Because if you are trying to fake it, then sooner or later people will find out. People are not stupid. These patients who come to your clinic, they are smart people. So if you're trying to just fake it, they are going to find out sooner or later. So one has to be genuinely curious about what you are talking about. It can't be just pre-framed scripts. An example, let's say a patient walks in and during a conversation, they say that they ran a marathon. And then you are genuinely interested as to how people run marathons because you are someone who gets tired with just 30 seconds of running. So you could genuinely, out of curiosity, ask this patient, how do you manage to do that? Because, I've always wanted to run and I'm someone who struggles with just 30 seconds of running. So how do you run a marathon? And then the patient might say, I was exactly like the same doc, but even I couldn't run 30 seconds, but I know this is how I did it. And now you learn something new. And who knows, that might lead you to run your first marathon. So this is what we mean by genuine curiosity, not just fake curiosity for the sake of talking something. We have to find something where we genuinely are interested in. Principle number 3 is empathy instead of solutions. One needs to start seeing things from another person's perspective rather than your perspective alone. One of the great therapists of all time is Milton Erickson, and he used to say, we have to enter the client's world and see the world through their eyes. This is a skill that can be learned with practice, and if you're able to do that, then your life will become a lot more easier as a doctor, as a dentist. Many dentists don't have this ability to see things from another person's perspective, and as a result, they really struggle. So that's principle number 3. Principle number 4 is not really a principle. It's one of the doubts we hear from students all the time. We talked a lot about fishing for topics out there, throw random topics, hoping that it will strike a conversation. Are there some topics that you need to avoid in the dental clinic? I think there are 3 topics that is probably better to avoid. And I learned this from Toastmasters. Toastmasters was an organization that I was a part of 25 years ago. It was an organization dedicated to improving your communication skills. And we had a rule in Toastmasters is that you can talk about anything you want except 3 topics, which is sex, religion, and politics. So I think we can take a leaf out of Toastmasters and bring that into the clinical practice. These 3 topics, sex, religion, and politics, are probably very slippery slope in the dental clinic. So it's best to avoid these 3 topics. Apart from that, I think pretty much anything we can talk about and fish around as common points of interest. So that's principle number 4, what not to talk about. And the last principle we need to talk about is when rapport doesn't happen. Now, we talked about all the efforts we put in to build rapport and connection with new patients, but there are instances that despite your best effort, you might land up in a situation where you fail to build rapport and communication. There's nothing wrong with it. If you genuinely put in effort and you failed to build rapport and communication, then understand that it's not always possible that you end up in a positive situation, because human beings are different. We all see the world through our own perspectives, and sometimes it can happen that you get a patient in your practice whose values don't align with your beliefs and values. So you might land up in a situation where you've put in all the effort, but you fail to develop rapport and communication. In that case, it's probably better to refer them to some other dentist whose values and principles might align with this particular patient's values and beliefs. This might seem complex, but the best way to look at it is, how do you figure out what the principles of your practice are? There is no hard and fast rule for this, but one advice we give students is that try and make the practice an extension of your personality, an extension of who you are, rather than making it something else very different from who you are in real life. An example, if you are someone who believes in paying professionals a very high fee for their services, then it makes perfect sense to start your practice as well into a practice where you charge a lot for your services. Let's say you're someone who doesn't believe in paying a graphic designer a lot of money for a good logo. Then why would you start a practice where you charge a lot of money for your services? It doesn't align with your beliefs. So that's what we mean. Let's say you're someone who goes everywhere and bargains for every single thing in life. Then don't be surprised when patients come to you and start bargaining. You should start a practice where bargaining is encouraged, because that's what you do as a person, right? So that's how you can align your values and beliefs into your practice itself. So it makes it less complicated. You can be true to yourself, and you will attract the kind of patients that align with your beliefs and values. This is principle number 5. Don't be surprised when rapport doesn't always happen. Now, this is a very complicated topic, but I hope that what we talked about right now kind of made it a little easy, or at least identified this problem for a lot of dentists who struggle with communication. I've seen a lot of talented clinicians struggle with this. They are unbelievably good at their work. They're good at solving the dental problem, but they struggle because they don't get the appreciation that they deserve, that their skills deserve, simply because they're not able to see this as a skill that they need to develop. They're very good at improving their skills when it comes to something related to dentistry, the technical part of dentistry. They will attend a program where somebody teaches them a new way of prepping a tooth, or new way of doing a composite restoration, or something like that. These dentists are really good, but hardly anyone attends a course saying how to improve my patient communication skills. However, that is the first thing that the patient's bothered about. The patient doesn't know about what kind of composite you put there or what matrix you put there. One of the most important things for a patient is, have you managed to connect with them as a human being? And I hope that this talk serves as an inspiration to those talented dentists out there who struggle because of poor communication skills. If you enjoyed that content, then maybe you would enjoy my weekly newsletter, which is a short email that I send out every Wednesday. It's usually filled with some useful dental and non-dental information. I've put the link in the description below. Do have a look and subscribe to my weekly newsletter called Wisdom Wednesdays. Don't forget to click on that subscribe button so that you get notified every time I upload a new video, which is usually every Sunday. And if you enjoy content like this, then maybe you should check out some of my other videos on this channel coming up over here. I'll see you next week with another video. Till then, take care. Thanks for watching.